Right now, at this very moment, there are thousands of people driving home from minor medical clinics.
Oh, absolutely. All over the place.
Right. Like they might be leaving the dentist after, a cavity filling, or maybe heading back from a quick mole removal at the dermatologist.
And they feel completely fine.
Exactly.
Oh,
They feel
yeah.
totally normal. But what they don't know is that the tiny dab of numbing cream they just received means their car insurance is completely legally void.
It is wild. I mean, if they get into a fender bender at the next intersection, they are entirely personally liable.
Which is just a massive blind spot for almost everyone who gets an outpatient procedure done.
It really is because, we all try to fit these appointments into the margins of our day. We are completely unaware of the legal and physiological tripwires we're walking through.
I call it calendar Tetris.
Oh, for sure. Calendar Tetris is the perfect term for it.
Right. You have a morning meeting, a lunch break, perfectly timed to drop off the dry cleaning, back-to-back afternoon calls.
Right.
And you are trying to squeeze in a medical appointment somewhere in between all of that.
Yep, just trying to make it all fit.
And when that appointment is for an intimate health procedure, specifically something called the O-shot well, the marketing materials make it sound like it's just another quick errand.
Which brings up a highly specific and honestly incredibly practical question for you, the listener.
Right. Can you really just pop out on your lunch break, get the O-shot, hop into your car, drive yourself back to the office, and immediately sit back down at your desk?
Well, the short answer is that the reality of post-procedure recovery is rarely as breezy as those brochures imply.
Yeah, not even close. Welcome to the deep dive, by the way.
We are looking at a diagnostic and regulatory landscape today that is just filled with glaring contradictions.
It's a fascinating stack of sources.
Mhm.
On one side of the desk, we have marketing brochures and medical guides from aesthetic urology and gynecology clinics.
And those sources promise quick lunchtime procedures with absolutely no downtime.
Zero downtime. But then on the other side, we have strict transportation, medical, and insurance guidelines from authoritative bodies.
Right, like the NHS, the UK's Driving Authority, the DVLA, and the RAC Motoring Organization.
And these authorities paint a fundamentally different picture of what you should be doing. And more importantly, what you are legally allowed to do after receiving local anesthesia.
So our mission today is to cut through all that conflicting advice.
Exactly. We are going to reconcile the promises of those clinic brochures with the hard realities of postoperative recovery and road safety laws.
By the end of this, we're going to give you a definitive answer on your post-O-shot mobility.
We're unpacking the work aspect, the driving aspect, and the biology of what actually happens to your body.
Because to really evaluate whether you can go back to your desk or get behind the wheel, we first have to establish a baseline.
Right, like what is your body actually experiencing in that clinic room? We need to look at the mechanics of the O-shot.
Okay, let's unpack this. The O-shot, or orgasm shot, is a non-surgical treatment aimed at female sexual dysfunction and urinary incontinence.
The sources note it's used for treating dyspareunia, which is painful intercourse.
And stress urinary incontinence as well.
Right. They also use it for conditions like lichen sclerosis, which, for those who might not know, is a chronic condition that causes patches of skin, often in the genital area, to become thin, white, and really prone to painful tearing.
And the mechanism that clinics use to treat these conditions is PRP, which stands for platelet-rich plasma.
This is such a fascinating area of regenerative medicine.
It really is. And the entire process starts with a simple blood draw, much like what you would experience during a routine annual physical.
But the science behind what happens to that little vial of blood is incredible. The sources specifically highlight systems like the M-site centrifuge.
So they take your blood, place it in this machine, and spin it at incredibly high speeds.
They are essentially using intense gravity and cellular weight to separate the components of your blood, right?
Exactly. The heavy red blood cells sink to the bottom, and the golden plasma, which is just rich with platelets, rises to the top.
I read that the centrifuge removes about 99% of those red blood cells, isolating just the platelets.
Yeah, and those isolated platelets are the primary engine of the treatment. They are densely packed with bioactive proteins and growth factors.
So when a practitioner isolates them and injects them back into specific areas of the body, they act as like a biological catalyst.
Precisely. They stimulate cellular regeneration, promote the formation of entirely new blood vessels, and trigger deep tissue repair.
They basically command your body to heal and rejuvenate the targeted area.
That's a great way to put it.
I picture PRP like hiring a VIP repair crew, but the crew is drawn exclusively from your own body. you know.
All that analogy, yes.
You were just relocating them to where the structural repairs are needed most, which, in this specific procedure, is the clitoris and the upper vaginal wall.
But because that specific anatomical area is so highly sensitive, you cannot just send that crew in unannounced.
Right. You have to numb the front door first.
You too. The practitioner must apply a heavy topical numbing cream to the genital area before any needles come near the skin.
And it's a highly concentrated local anesthetic.
Exactly. Which brings us to the critical detail for our focus today.
Right, because it's not the injection of your own platelets that throws a wrench in your afternoon plans. It's the numbing cream.
Because the PRP is autologous, meaning it is manufactured entirely from your own biological material, the risk of an allergic reaction or bodily rejection is vanishingly small.
The actual healing agent is completely natural to you.
Right. The local anesthetic is the external variable here. That numbing agent alters your physiological state, and it changes the entire trajectory of your immediate physical recovery.
Okay, so let's test that recovery against the return to work reality check.
Let's do it.
Because the clinic materials we reviewed advertise the O-shot as a quick 30 to 60-minute outpatient procedure. They explicitly state you have little to no downtime, and that returning to work the very same day is standard practice.
And, I mean, from a purely surgical categorization, that is technically accurate.
Because you aren't going under.
Right. You are not undergoing general anesthesia where you are rendered unconscious. There are no scalpels, no surgical incisions, no mandatory observation periods in a hospital recovery bed.
But hold on, let's play out the actual physiological reality of the next few hours.
Okay.
You leave the clinic, you take the elevator up to your office, and you sit down at your desk. The sources note that the numbing effect from that local anesthetic lasts anywhere from 4 to 6 hours.
Yes, and as that heavy numbing agent begins to wear off in the middle of your workday, it is not a smooth, invisible transition.
No, definitely not.
You are going to feel a heavy ache, a throbbing sensation, tingling, and a massive increase in sensitivity in a highly intimate area.
Because your body's actively initiating a localized healing response.
Exactly. The platelets you just injected are purposefully causing localized inflammation to kickstart the tissue repair process.
Which is funny because inflammation often gets a bad reputation.
It does, but it is the body's first crucial step in calling stem cells to an area to begin rebuilding tissue.
And this is where the pain management protocol becomes a massive hurdle for the office worker.
Oh, it's a huge hurdle.
Because you absolutely cannot take an NSAID. No ibuprofen, no naproxen, no aspirin.
That is a non-negotiable medical directive from these clinics. NSAIDs are, by definition, anti-inflammatory drugs.
They work by inhibiting the specific enzymes that cause inflammation.
Right. So if you take them to manage the thriving ache, you're actively suppressing the exact inflammatory cascade that the PRP relies on to function.
So taking an ibuprofen is basically throwing a bucket of ice water on the exact fire I just paid a clinic thousands of dollars to start.
Yes. You are neutralizing the treatment entirely. Because of this, you are strictly limited to acetaminophen or paracetamol.
Because that manages pain signals in the brain without reducing the localized inflammation?
It's
But wait. If I am dealing with a throbbing, localized ache in a highly sensitive area, and I am restricted to just paracetamol, I am not going to be sitting comfortably in an ergonomic desk chair for a 3-hour budget meeting.
Probably not.
The clinic's narrative of breezy, no downtime seems a bit overly optimistic when you factor in the physical distraction.
If we connect this to the bigger picture, the clinical reality is that returning to work is technically and medically permissible. But you have to actively manage your expectations.
You won't be physically incapacitated, but your focus will be compromised.
Exactly. If you choose to go back to your desk, you should expect to take it easy, rely on loose clothing, and accept that you will not be operating at peak productivity while the anesthetic wears off.
Okay, so we can put work in the category of a conditional yes. Heavily dependent on your personal pain tolerance and how forgiving your office chair is.
That's a fair assessment.
But eventually, the workday ends. Or maybe you are just trying to leave the clinic to head home. This brings us to the most dangerous part of the entire procedure.
Your car keys.
Yes, can you hop into your vehicle and drive?
And this is where our stack of sources splits into two wildly contradictory universes.
Here's where it gets really interesting. In Universe A, the aesthetic clinic materials, for example, the literature from the Center for Advanced Urology, explicitly state, and I quote, "You may drive yourself home after the procedure."
Right. But in Universe B, the driving and medical authorities lay down an absolute non-negotiable veto.
It's completely black and white.
It is. Guidelines from NHS Tayside, the RAC, and the DVLA state unequivocally that you cannot drive for at least 24 hours after receiving a local anesthetic.
A full 24 hours. That is a staggering discrepancy from a clinic telling you to just grab your keys and head to the parking lot.
It really is.
And the consequences outlined in the sources aren't just like a friendly warning from the DMV. It is a severe insurance trap.
The legal framework here is incredibly rigid.
The sources explain that if you drive within 24 hours of receiving any local anesthetic, your car insurance policy is legally invalidated.
Because the concept of material disclosure applies here. You have chemically altered your state and failed to inform the insurer.
So if you get into an accident on the commute home, the insurance company will not cover the damages. You are held entirely, personally liable.
And it gets worse. The RAC guidelines also note that driving while medically impaired by an anesthetic or failing to declare that impairment can result in immediate fines.
Up to £1,000, depending on the jurisdiction, right?
Exactly.
So I am sitting in an aesthetic clinic, and the doctor is telling me it's perfectly fine to drive. But the legal reality is that I am completely uninsured the literal second I turn the ignition.
This raises an important question, doesn't it?
How do two authoritative sources exist with such a glaring, dangerous disconnect? I mean, I have to guess that the aesthetic doctor is only looking at my literal driving tools, like my hands and my feet, while the insurance company is looking at the chemicals swimming in my bloodstream.
You hit on the exact mechanism of the disconnect. We have to synthesize this by looking at the fundamental difference between localized clinical recovery and systemic legal risk.
Okay, break that down for me.
So, the aesthetic surgeon is focused on localized physical impact. They injected PRP into the vaginal wall and applied a topical cream to the surrounding tissue.
Right.
They know for a fact the procedure did not physically sever a tendon in your leg or impair your eyesight. Anatomically, your hands can grip a steering wheel and your feet can press the brake pedal.
The surgeon knows they didn't operate on my driving foot, so to them, I am road ready.
Exactly. But the insurance companies and the road authorities, they do not care about local anatomy. They are evaluating systemic risk.
Because any introduction of a local anesthetic, even just a topical cream, has the potential for systemic absorption into the bloodstream.
Right. The skin absorbs it, and the bloodstream carries it everywhere.
Including the brain.
Precisely why roadside authorities operate the way they do. If you are pulled over or involved in a collision, a police officer on the side of the road cannot perform a test to determine if the anesthetic in your system is safely localized to your pelvic region.
Right, they can't just check and say, oh, it's only right there.
No, they don't know if it has crossed the blood-brain barrier and is affecting your cognitive processing speed. Because they cannot measure the localization, they rely on absolute risk reduction.
So any anesthetic in the system equals impairment.
Yes, it is a blanket liability ban.
So the clinic views you as a successful, anatomically intact patient, but the insurance company views you as an unquantifiable liability risk.
That is the perfect way to summarize it.
But let's look past the legal theory for a second and focus on the physical biomechanics of the drive home. Like, let's say someone decides to risk the insurance void. Is it physically safe to operate the vehicle?
According to the medical transportation guidelines, it is absolutely not safe.
Not at all.
No. To operate a vehicle safely, the fundamental baseline requirement is that you must be free from distracting pain, and you must be physically capable of performing an emergency stop comfortably.
As we discussed with the office chair scenario, as that numbing cream begins to fade during a commute, distracting pain is exactly what is blooming in your body.
But even before the throbbing ache sets in, the local anesthetic and the clinical setting itself can trigger unexpected systemic side effects.
The sources point out that local anesthesia, combined with the procedure, can cause mild drowsiness, fatigue, or sudden lightheadedness.
Right.
It's just hard to imagine that a localized cream causes full-body fatigue. It sounds more like an adrenaline crash.
Well, the adrenaline crash is a huge factor. The body mounts a systemic stress response to the procedure.
Because you've had blood drawn, you've been navigating a clinical environment.
And you have had a highly sensitive area of your body manipulated and numbed. That entire sequence causes a massive spike in cortisol and adrenaline.
And when the procedure's over, those hormone levels just plummet.
Exactly, leading to sudden, profound fatigue behind the wheel.
Now, there is another biomechanical danger here that the sources highlighted, which honestly made me wince.
Oh, the masking effect.
Yes. The danger isn't just the fatigue or the pain. It is the danger of the numbness itself.
The disruption of the sensory feedback loop.
Think about driving a car. It is operating heavy machinery. To do it safely, you rely on a continuous sensory feedback loop from your nervous system.
Your brain needs to know what every muscle is doing.
Right. But after the O-shot, a crucial part of that feedback loop in your pelvic region has been temporarily switched off by the heavy anesthetic.
It's like you are driving your car, the engine is running hot, but the mechanic disabled your dashboard warning lights, so you have no idea.
That is exactly it. And the RAC and NHS guidelines emphasize this exact danger. Numbness means you will not feel physical damage occurring in real time.
So imagine you are driving home and a car suddenly cuts you off on the highway. You have to perform an emergency stop. You slam your foot on the brake pedal.
And when you slam on the brakes in an emergency, it's not just your ankle moving. Your entire core tenses to brace against the G-force.
Your pelvic floor violently contracts to act as an anchor for your body.
And because you are heavily numbed from the procedure, you do not feel that violent contraction.
You push those delicate, newly treated muscles far past their normal tensile strength.
You might strain the injection site or cause deep internal bruising and micro tears in the tissue.
You rip down the very cellular scaffolding the PRP just started building, and you won't even realize it until hours later when the numbness finally wears off and the severe pain hits.
You completely ruined the expensive regenerative procedure you just paid for simply because your body couldn't tell you to stop bracing so hard.
Yeah.
That is a horrifying physiological reality.
It really is, which perfectly illustrates why safety is not just about whether your hands can technically steer the wheel.
Right. Safe driving requires split-second reaction times.
And the cognitive awareness to deal with unforeseen hazards, plus the physical ability to protect a fresh procedural site from sudden, jarring biomechanical movements.
So the smartest choice, universally recommended by the medical authorities and the driving guidelines, is to remove yourself from the driver's seat entirely.
Pre-arrange a taxi, use a ride-share app, or get a lift from a friend who understands you need to recline the passenger seat and take it easy.
The clinical advice to drive yourself home, found in some brochures, is just dangerously out of step with the legal, chemical, and biomechanical realities of road safety after anesthesia.
Completely out of step.
So, to bring this all together and deliver the final verdict for you, the listener, who is trying to successfully Tetris this procedure into a packed schedule, can you return to work?
Yes. Medically and legally, you can return to the office.
However, you must manage your expectations. You are going to experience temporary numbness shifting into a heavy ache. You will likely be distracted, and you must remember that you can only manage the discomfort with paracetamol.
Because NSAIDs will destroy the regenerative process.
Right. Work is feasible, though it demands a high tolerance for distraction and mild discomfort.
But driving is a definitive absolute no.
Despite what a very optimistic, anatomically focused clinic brochure might imply, driving yourself home is a massive liability.
It legally invalidates your car insurance, making you personally responsible for any accidents.
And it fundamentally compromises your physical recovery by masking potential damage to the treatment area.
Bypassing the driver's seat is the only way to protect both your physical investment in the procedure and your legal standing on the road.
Which leaves us with a final, lingering thought for you to mull over. We started this deep dive looking at how to fit one specific regenerative procedure into a busy Tuesday schedule.
And in doing so, we uncovered the fact that receiving a standard local anesthetic technically invalidates your car insurance for a full 24 hours.
Consider the sheer scale of that rule.
The breadth of that liability ban applies to almost every minor outpatient intervention.
Think about how many millions of people are out on the roads today. People are driving home from the dentist with a numb jaw.
Or leaving a minor dermatology appointment after a biopsy.
Or heading back from a quick cosmetic filler appointment at a med spa. They're out there navigating 4-lane highways, completely uninsured and legally exposed.
Without having the slightest clue that their policy is void because of a topical cream.
Exactly. So the next time you try to perfectly schedule a quick medical errand into your afternoon, remember that your car insurance might be the one block that simply doesn't fit.
It definitely changes the way you view the traffic around you, doesn't it?
It really does. Thanks for joining us on this deep dive.